Investment advisory services are offered through Fusion Capital Management, an SEC-registered investment advisor. The firm only transacts business in states where it is properly registered or is excluded or exempted from registration requirements. SEC registration is not an endorsement of the firm by the Commission and does not mean that the advisor has attained a specific level of skill or ability.
Welcome to Navigating Retirement with Rick Durkee.
Hey, welcome into Navigating Retirement. I'm your host, Rick Durkee. Got a special guest with me here today, Jason Mackey. Jason, glad to have you.
Yeah, thanks for having me.
You've been a guest on our shows over the years. But before we get started, I'd like to remind you to like, subscribe, and most importantly, share this episode and past episodes of Navigating Retirement. Sharing is caring. Share this information with others you know and care about that'll benefit from today's topic. It's so easy to do this in today's digital world. Hit the like button, the share button, or ring the bell. We have offers to send you today, many informational resources that'll be described below that you can click on and request your copy of that information. Simple to do. Click on it. You'll get some resources today. Let's get started with today's episode of Navigating Retirement. So welcome, my guest, Jason Mackey. Hey, how are you doing today, Jason?
Nice to see you, Rick.
Now, Jason has been since 1998 in healthcare and healthcare advice. He's the author of Medicare Blueprint. For those of you that might be reaching Medicare age, we'll always make this book available to you here from the Coastal Financial Planning Group. It's available to you here today also. But our topic today is the American Retirement Plan Act. And it's known as ARPA. But it made some changes in the ACA, as I talked about in our first episode. And today, what I want to talk to you about is some of those changes. We're going to talk about pre-ARPA and post-ARPA. And Jason, why don't you just help lead into this? Before ARPA, the American Rescue Plan Act of 2021, we had the health exchanges, right? We had ACA. We had people that were getting subsidies on their health insurance through either tax credits or from premium reductions.
Correct.
Right? But there was some limits on that. So tell us a little bit about how it was pre-ARPA.
Yeah, absolutely. So before, it was based on your household income, and there was a limit. So if you were 400% of the federal poverty level, then there was what they would call this subsidy cliff. So if you made $1 over that 400% of the federal poverty level, you were not eligible for a subsidy. And if you did receive the subsidy and ended up making more than that, then you had to pay it all back in taxes.
Yeah.
So,
and you gave me an example about that. Somebody went on a trip or something. Tell me that.
Yeah, they went on a vacation and then came back to find in the mail that they got a special dividend from a stock. And that special dividend put them over the limit.
And so they fell off the cliff.
So they fell off the cliff, and they ended up having to pay all of that special dividend and then some back onto in their taxes. So it was pretty painful.
You had to manage that threshold or that window of opportunity to be able to get the ACA.
Right. And so you just were kind of threading the needle. And in some cases, you just went, like I said, $1 over, and you had to pay all that money back. Yeah,
I had a couple of clients here at the Coastal Financial Planning Group that I referred to you. We've worked together for many years, 20 years plus. Yeah. And just top of mind, I can think both of them, we had to really work hard managing their retirement income plan to keep under that threshold of income, which was how much?
Yeah. So for an example, a family, a household of two, that used to be about $69,000.
Yeah.
So the enhancement of that subsidy cliff is now it doesn't matter what your income is. You just pay a percent of your income. So it is a huge benefit to people now that are looking to retire and they want to do it before 65. This is a big opportunity for them to be able to get affordable insurance while they're waiting for Medicare.
Yeah. In the first episode I shared with our listeners and viewers, the situation I was poised with, my wife was retiring from a major airlines, and we had to decide should she retire because she provides both of our health insurance through her group health plan.
Very common.
Yeah. And so now we're post. Okay. Let's get right into these details. And listen, there's a lot of details here. We offer a white paper on this subject created by our in-house to-be CFP. He works with our retired CFP here at the Coastal Financial Planning Group, and he's going to be joining us in the third episode. But we're really looking at an opportunity for you today to find details about what we're talking about inside of our white paper. We're referencing it today. There's a lot of details inside that white paper. Make sure you get a copy of it, because there's going to be 3 opportunities for you to follow up with us here today. And that's one of them. So Jason, let's talk a little bit about this now. Here we are. This information slid in under the radar, right? Okay. Yep. A lot of people didn't know about it. And I'm sure you listeners and viewers here of Navigating Retirement weren't aware of it, but please share this information. This is big information. Our media is not reporting it. It slid under the wire, but it was really our way of our government really getting more people in the healthcare exchanges, right?
Absolutely. So,
and getting employers out of the group health insurance business,
correct.
As you found.
We were seeing that employers, it's more beneficial for them to drop their coverage so their employees can get these subsidies, because it's more than the subsidies are more than what the employer can contribute towards the health plan. And in some of these cases, I mean, these subsidies, with the this Rescue Plan Act, it is a 66% increase in the amount of subsidy that they receive. So,
oh, wow.
Yeah, it's substantial. Yeah. And so we're seeing people that are even currently on it, they're getting huge reductions in their monthly premium. It's not automatic, so they do have to go in and what they call redetermine their policy, and it will reset down to that lower premium.
So these are people that are already in the exchanges.
Correct.
Okay, and they can save money.
That's right.
And people that were getting ready to retire maybe now could get into the exchanges.
Yeah, if they've looked at it before, you're 60, 62, and you're trying to figure out how to afford retiring early before Medicare kicking in. You may have looked at it before, but it's a game changer. I mean, this could be the difference between you retiring at 62 versus 65.
Yeah, Jason cares. He wrote this book, Medicare Blueprint, because he likes to educate people. He spent a lot of time tearing apart this ARPA, American Rescue Plan Act of 2021, and looking at how it affected his business, his group health insurance plans, and also what it would mean to the individuals. So, Jason, maybe you could just share with us how that 69,000 that you mentioned before now has changed post with ARPA.
Yep. So 69,000 again was that cliff, but now it's you would just pay. There's a formula, but basically 8.5% of your household income is the cap. So we can do a calculation really quickly and tell you how much of a subsidy you qualify for and what that means. There, in some of the cases, a couple that are both 62, they can get a plan if they're making $60,000, $70,000 a year for 0 premium per month, maybe $20 a month. So yeah, it's pretty significant.
Didn't you bring some examples with you today here?
I did have a couple of examples. I think I left them in my portfolio, but yeah, that was one of them. But it's a substantial amount that they should consider.
Yeah.
And it's cheaper than COBRA. If they're leaving their employer plan, some people think, well, I'll just take COBRA for 18 months. But in most cases, this is going to be less expensive.
Very good. Very good. Tell us a little bit about the subsidies. I mean, there's a couple of ways now that people can save money on their health insurance. One is just through reduction in cost of the premiums that they pay. Second is through tax planning and tax credits that they get back.
Correct. So this is an advanced tax credit, so you can take it now, or you can get that credit when you file your taxes. So it's your choice. Most people, the majority of people, opt to go ahead and have the lower monthly premium now. It is reconciled when they file their taxes, so they can't just say, "Oh, I make $20,000 a year," and they're going to get a subsidy based on that. So it is very important to have a good estimate of what your household adjusted gross income is, to make sure that you're getting the proper amount of subsidy. And I usually tell people to, be conservative and maybe, because you're guessing what your income will be for the year, to estimate on the higher end. So you have a little bit of padding there. So when you do file your taxes the next year, for this year, you'll potentially get some additional money back on your taxes.
Okay. Now, hey, in today's world, information flies fast, right? We have limited time to be able to get information and find information. You can follow up today with a copy of this white paper. We'll have Nathan White joining us in a minute here with Jason, so we can tie this all together from the financial, tax planning, and retirement income planning standpoint. Jason, is there anything else that you'd like to leave our viewers with today that you feel that really it's something that you want to share with them, that when you read this and you said, man, this is an opportunity people don't need to miss?
Yeah, and that's exactly what I've been telling people is it's a game changer. It really is. It's exciting. And insurance is usually not an exciting topic, but it's something that everybody needs to look into and see if now is the time. You may have bought that opportunity of some extra years in retirement. So that's exciting.
Yeah.
And I think in the next section, we'll talk a little bit more about, income planning and stuff like that, as you're alluding to, because there's ways to keep that income down to maximize that subsidy. So we'll discuss some of that as well.
Right. So business owners, individuals. Jason called me and said, man, I'm going to be working harder than I've ever have all my career for the next 12 months for sure, 18 months maybe, but he's going to be converting group health insurance plans to individual plans so they can, take advantage of this.
Absolutely.
Yeah. So, hey, if you're an employee, if you have individual health care, if you are an employer, certainly join us for episode 3 and 4 of Navigating Retirement. We're going to be right back with Nathan White in segment 3 right after this.
Catch more of Rick Durkee and Navigating Retirement by visiting cfpgroup.biz.
While we believe the information in this broadcast is reliable, we cannot guarantee its accuracy. Opinions expressed are subject to change without notice and are not intended as investment advice or solicitation for the purchase or sale of any security. Please consult your financial professional before making any investment decisions. Investment advisory services are offered through Fusion Capital Management, an SEC-registered investment advisor. SEC registration is not an endorsement of the firm by the Commission and does not mean that the advisor has attained a specific level of skill or ability. Investment in securities or the market involves a potential risk for loss of principal. Trading, therefore, may not be suitable for all listeners. Annuity guarantees are based solely on the financial strength and claims-paying ability of the issuing company. Withdrawals of growth from annuities may be taxable as ordinary income in the year it is taken. Individuals should review contracts for specific details of the product's features and costs. Early withdrawals may subject the owner to penalties, fees, or taxes.
Fiduciary duty extends solely to investment advisory advice and does not extend to other activities such as insurance or broker-dealer services. Advisory clients are charged a fee for assets under management, while insurance products pay a commission, which may result in a conflict of interest regarding compensation.
Third-party rankings and recognition from rating services and publications do not guarantee future investment success. Working with a highly rated advisor also does not ensure that a client or prospect will experience a higher level of performance. These ratings should not be viewed as an endorsement of the advisor by any client and do not represent any specific client's evaluation. Generally, ratings, rankings, and recognition are based on information provided by the advisor. Please contact the advisor for more information regarding how these rankings and ratings were formulated.